What's going on, guys? It's your boy Brad. I'm coming at you again with another video today, another educational video, one for my nursing students out there. And this is how to perform the head-to-toe assessment. We all get taught this. Every nursing program all over the world teaches the head-to-toe assessment. So in your mind, you should think it's probably a pretty big deal, something that I need to learn. So we're going to talk about that. I'm going to give you the full head to toe, run you through it, tell you what to look for, what abnormalities to look for. Hope you guys enjoy the video. Now, before I dive into this thing head first, get it head first, make sure you hit that subscribe button down below if you haven't already. I'm putting out videos every week trying to help you guys obtain your dreams of becoming a registered nurse. Enjoy the video. So with a head to toe assessment, there's many ways that you can approach it. And whenever you get on the floor and you get it down pat what all the head to toe assessment entails, you can approach it however you want to. You get your own way of doing it. I'm just going to teach it from head to toe. Now, why is this important? This is an important thing that every nurse needs to learn, because whenever you get a new admission, a new patient on the floor, a new assignment, you don't know anything about this patient, you need to get a good baseline of this patient. You need to assess that respiratory status, that those cardiac system, the GI, GU, everything, to get a good baseline on the patient so that during your shift, if anything changes in the patient's respiratory status, if anything changes that, physiological difference, you need to be able to, hey, there's something wrong, there's something different with this patient, because you've already got a good baseline for where the patient was when you first got them on the floor. So beginning with the head, what do? First thing you do is you want to check the head, the hair. You want to look for any cuts, any bruising, hematoma, anything that's out of the ordinary, dandruff, lice, whatever. Okay. After that, oh, and by the way, what are you going to need? You're going to need a stethoscope, and you're going to need a pen light. And that's really it. Let me also mention before I continue into this is that collecting vital signs is also part of the head to toe assessment. I'm not going to really go into that because at this point, hopefully you do know how to collect basic vital signs with the temperature, the respiratory rate, all of that good stuff. So, but yeah, that's part of your head to toe assessment. Just throwing that out there. So moving on. What I would do then is I would move on to the ears. You want to look at the ears. You want to look behind the ears for any skin breakdown. You want to look in the ears with your pen light. So if it's an adult, pull up and back and look in there with your pen light. Okay, both ears. Next, I would move on to the eyes. You've heard of PERLA, right? P-E-R-R-L-A. Pupils equal, round, and reactive to light. And the A stands for accommodation. So that's what you want to assess then with the eyes. Dim the lights. If they wear glasses, take off the glasses. Okay. And you want to assess the pupils, how they are reactive to light. So you assess the first eye, come back around, and assess the other eye. And you're just making sure that the pupils constrict in the presence of light and that they dilate when the light is absent. Just making sure, it's a neurological test. Then after that, you want to assess their 8 fields of gaze. So you say, I want you to follow the tip of my pen light. I'm just going to move it nice and slow. If you feel nauseous or dizzy or anything while I'm doing this, let me know. I'll stop. But you just want to give them that. So you tell them to look, and you're assessing the 8 fields. And they're just following their pen light with their eyes. 1, 2, 3, 4. Obviously not going this fast. 5, 6, 7, and 8. So up, down, right, left, diagonals. The 8 fields of gaze. And then the accommodation piece comes in, where basically you want to see how well their eyes accommodate, alternating from one object to another. So what you can say is, I want you to look at my pen light and then point at another object in the room, the television, the sprinkler head on the ceiling, whatever. I'll say, I want you to look from here and there and back, just with your eyes. And you just want to see how well their eyes accommodate to the objects that they're looking at. Next thing I would do is I would move on to the nose, okay? It's just, we're going from head to toe. You want to look back and you just want to look in the nose, okay? Tell them to open up their mouth. You want to look in their mouth. You want to assess the mucous membranes. Make sure they're pink. They have all their teeth. There's not any dental problems. No lacerations of the tongue. There's all kinds of abnormalities that human beings have. So you just want to do a general assessment. You're looking in the nose, looking to make sure, it's patent. It's not occluded with anything like that. Next thing that I would do, and at this point you're pretty much done with the pen light, I would move on down to the neck. You want to palpate the neck. You're checking for any enlargement of the lymph nodes. If you have any pain while I'm doing this, let me know, but you're just feeling for any enlarged lymph nodes. At this point, you can go ahead and check the carotid artery. Now, whenever you're checking pulses, you can, whatever pulse it is, you can check them both at the same time. But when it comes to this, don't do them both at the same time, because you do that and you cut off blood flow to the brain and your patient blacks out on you. Check one at a time. And you're not checking heart rate with that. That's a big misconception that a lot of students have, is that they're checking heart rates with all these pulses. You're not. You're just making sure that there's something there, that you're feeling blood flow through, that it's not an occluded artery or anything like that. Okay, so after you've done that, another thing that you can do is you can take your stethoscope and you can put it over the carotid artery and listen for any bruit. Now, whenever you put your stethoscope over here and you listen, what the normal thing to hear is nothing. You shouldn't hear anything. But if you hear like a swooshing sound, like blood flowing through an artery, that's not a good thing. That's a bruit, or you're hearing a bruit, and it's indicative of basically some sort of partial occlusion of that artery. There's something partially occluding it, producing that sound, and that's not a good thing. That's problematic. So it's good just to listen for that. Before I moved on to the thoracic cavity, where you're listening for all of the major lung sounds, heart sounds, and all that stuff, I would move on to the arms personally. So you're assessing the arms, looking in the armpits, any skin breakdown, anything like that, looking at skin color, making sure that it's just appropriate for the patient's ethnicity. You want to look at dry skin, anything like that, any, like I said, skin breakdown, general things like that. If they have an IV in, you definitely want to be assessing that IV site. Is it clean? Is it dry? Is it intact? Is there any infiltration, phlebitis, anything like that? Is the date, within the policy and the clinical site that you're in? And so you want to look at the tubing. Is the tubing within date? What IV fluids are running, if there are any, and at what rate? Things like that. Next, I would move on to the pulses. You want to check, and remember, you can do these at the same time. Check the brachials, both radials, okay? Again, you're not counting heart rate, you're just making sure that they're there. And of course, there's a rating system, 1+, 2+, 3+, 4+. I'm not going to get into all of that. But anyways, after you check the pulses, make sure that they're there, that they're present, you can move on to the hands. You want to make sure that you check cap refill on both sides, making sure that it's less than 3 seconds. Then you could do skin turgor. Now, different programs teach different places in which you can assess skin turgor. I just do it here. You want to make sure that it doesn't take longer than 3 seconds for it to go back down. And that's just indicative of them being well hydrated. While you're at the hands, you also want to assess the grip. So you can say, squeeze my fingers, and they do it with both of their hands, assessing the strength of their grip. And then you can put your hand here and say, I want you to push against me. And then I want you to pull back. And you do that with both hands, push and pulls of the hands. And after that, you're pretty much done with the arms. What I would then do is I would move on to the heart sounds. That would be the first thing that I do. So with the heart sounds, you know that there's 5 major landmarks, right? You've been taught this, I hope. If you haven't, you're learning it now. There's 5 major landmarks that you can listen for whenever you're assessing cardiac status. Aortic, pulmonic, herbs, tricuspid, and then off screen is the mitral. And at the mitral valve is when you want to listen for a full 60 seconds. Of course, this isn't the actual where the mitral valve is located, it's just where it's heard. You want to listen for a full 60 seconds. They call it the apical pulse. And that is where you should assess your heart rate whenever you're doing a full head to toe assessment. After that, you can assess the respiratory status. Okay, and whenever you're listening to the heart sounds, all you're listening for is S1 and S2. I mean, if you got a good enough ear, maybe you can hear some murmurs, pick up some things like that. But for just a basic head to toe assessment for new nursing students, all you're listening for is lub-dub. Okay, moving on to the respiratory status. Different programs teach it differently, but my program says you want to check 6 landmarks in the front, 8 landmarks in the back. So all you're doing is breathe in deep and breathe out for me, and it's 1, 2, move down, 3, go across, 4, and then 5 and 6 are more laterally located. Okay, 5 and 6. And you're assessing for any stridor, wheezing, rhonchi, crackles, things like that, things that are abnormal, indicative of a respiratory issue. At that point, if you wanted to finish your respiratory assessment, you could have them sit up and listen to the 8 landmarks on the back, or you could wait until the end, which is what I'm going to do here in this example. So after listening to the respiratory status, okay, you can move on to the abdomen. Now, whenever you're looking at the abdomen, the first thing that you want to do is you want to inspect. You just want to look. Is the abdomen distended? Is it discolored? Stretch marks? Anything like that. You just inspect first. Then the next thing that you want to do is you want to auscultate. And you want to auscultate in the, basically along the tract that the large intestine runs. The first thing is 4 quadrants. The right lower quadrant, the right upper quadrant, the left upper quadrant, and then the left lower quadrant. And all you're doing is listening for bowel activity. That's it. After you've auscultated it, the last thing that you want to do is you want to palpate it. Just gently run your fingers across it, pushing down, asking if there's any pain, any discomfort, anything like that. And there's a lot of questioning that goes into this too. You know, when was your last bowel movement? You know, was there anything different about it? Black, tarry, what's your normal, routine for bowel movements, things like that. And also at this point, you can begin assessing the GU. You're wanting to assess, any skin breakdown due to incontinence. Do they have a Foley catheter in? If they have a Foley catheter in, you want to be looking at urine output. And of course, the characteristics that go along with it, color, clarity, is there any sediment, things like that. You also, if they don't have a Foley catheter though, you can ask, how often do you void? Have you had any troubles urinating? Any burning sensations? Anything like that? Just a lot of general questions to assess and gain a good foundation of knowledge of what this patient's normal habits are. So then, you're moving on to the legs. You're looking at the legs. Again, like I said, you're looking for skin breakdown. There's a lot of pulses, so you can check the femoral pulses. You can check the popliteals, move down to the feet. You can assess, the dorsalis pedis. There's one other one, I can't remember the name of it. Just assessing these pulses. Whenever you get down to the feet, kind of the same things with the hands. Check the cap refills on the toes. You want to do the push and the pull with the feet. Looking in between the toes for any skin breakdown. Looking at the heels for any ulceration. You can ask them about their calves. Do you have any tenderness or pain in your calves? Any burning sensation like hot charcoal? And really what that is you're, in your mind, you're assessing for the possibility of a DVT. And it's at this point where I would have the patient turn over on their side, or I would sit them up. And then this is when, now that I'm done with everything except for the back side of the patient, when I would listen to the lungs in the back, those 8 landmarks. So I'd listen to the lungs in the back, have them turn over. I'm just checking their back, looking for ulcerations, the sacral area, just observing. A lot of it is observation. And then of course there's other pieces to it. You can check range of motion of the shoulders, of the legs. If it's a female patient, you can ask about the menstrual cycle. When was your last period? Are you sexually active? Obviously you can ask men and women that. Trying to get an assessment of their reproductive function, things like that. But yeah, that's basically the head-to-toe assessment. I know I kind of flew through it. As you do the assessment more and more, you'll get quicker at it. My first time doing it, I probably took a good 30 minutes. Some people out there might be watching this like, God, that's embarrassing to admit that, but a lot of people do that, man. A lot of people take longer, and whenever it's your first time, you're really just you're mentally in the zone, trying to make sure I don't miss anything. Did I check the radial pulses? Did I check skin turgor? Just things like that. But as you do it more and more, you'll get a really good feel for what you need to assess, what questions you need to ask, how to transition. Just you'll get your own routine is what I'm trying to say. So just practice, guys. Practice makes perfect. I wish you well. I hope you enjoyed the video. If you did, leave me a comment down below. Let me know what you thought about it. If I missed something, leave me a comment down below and let me know what I missed so that my fellow nursing students don't miss it. I think I covered everything though. But anyways, guys, again, subscribe if you haven't already. I'm putting out those videos every week for you guys. I'm putting out more than one a week, to be honest with you. But it's to help you guys succeed in nursing school because we're all in this journey together. Anyways, this Nurse Bass soon to be, baby. I'll catch you in the next video. Peace.